Alright guys, so now we will be discussing with the different aspects of this central incisor. But before that, I just want to tell you this: what are the main functions of this tooth? So the main functions of this tooth is that they help in shearing and cutting of food, right? That is the main function of these central incisors. So what else we can see now? The different features of this central incisor. We will be discussing the different aspects or different views or surfaces of this tooth. So the labial aspect, that is the front view. What do we see? So the mesial side is straight, it has a straight outline, and the mesial incisal angle, this angle, is sharp, while the distal side is more curved and the distal incisal angle is more rounded. The labial is less convex than that of the maxillary lateral incisor. The labial side is less, this convex, a bulge is there in the front, so it is less than the lateral incisor. It's just a comparison. Okay, so we will be learning the lateral incisor also, but in the next video. So now the labial lobe terminates incisally in the mammalions. This labial lobe, a small lobe, it terminates in the mammalions. What are the mammalions? So mammalions are small protuberance found in the incisal ridge of newly erupted incisors over here. Okay, so these mammalions, they are not there in the used ones because of the mastication. These mammalions are no more, but in the newly erupted teeth there are mammalions. And if there is any misalignment of the tooth, then this mammalion might survive. That means they might escape the incisal wear. Now, what are the imbrication lines? There are imbrication lines seen over here. So there are slight ridges that run mesodistally. What is mesodistally? Okay, mesodistally in the cervical third. Okay, this is the cervical third. I have also explained all those middle third, cervical, incisal third. I think it's clear by now. Now, what is the possible? There's a possible distal deviation of the root. So there's a distal deviation. Okay, the root is slightly tilted this side. Okay, so we're done with the labial aspect. Now lingual aspect. So this lingual aspect, there are convexities and concavities, so it's kind of irregular over here. Okay, so there's a convexity, that is the cingulum, and concavity, that is the lingual fossa. So as I have already told you what is the cingulum, okay, I think we're clear now. So the cingulum in the cervical third, and there are mesial and distal marginal ridges running, okay, along marginally. And so these marginal ridges and cingulum form the boundaries of the lingual fossa. So a horizontal placed groove may be present that separates the cingulum with the lingual fossa. There might be a small groove over here which separates the cingulum and the lingual fossa. And when you take the cross section of the root, there's a triangular rounded angle which is labially, and the mesial and distal sides pointing lingually, like this. Let me just draw this for you. When you take a cross section like this, so when you visualize it, it's something like this. The apex is pointing lingually, where this mesial and distal sides are making this, and the rounded side over here is labially. Okay, so whenever you take this cross section over here, I hope this is clear. Now for the mesial aspect, it is quite simple. So here it curves incisally to great extent. this cervical curvature is greatest on the mesial surface of this tooth than any surface of any other tooth in the mouth. What do you understand by this? That this cervical curvature, this is the greatest for this tooth's mesial aspect than any other. Like if you see the distal aspect of the same tooth, it's not that curved, but here this is the greatest for this one, the curvature. Okay, in no other tooth it is so much curved. And labiolingually, in the incisal portion, it is more convex than cervical portion. So labiolingually, that is labio and lingually, this way, if you see, then this is more convex in the incisal portion than the cervical portion. This is kind of flat, but this is more like convex, okay, when you see from here. So even the distal aspect is almost same as the mesial aspect, not much difference is there, but few differences that are there, that the curvature of this one I've already told you that it is lesser on the distal side than the mesial side. And the mesial surface, in the mesial surface, the incisal portion is more convex. So here it's not that convex, it's less than this one. And the last aspect is the incisal aspect. Over here on the lingual surface of the incisal view, this is the lingual surface, okay, the mesial is longer than the distal marginal ridge. The mesial is, so this is the mesial, so it's longer than the distal, okay, that is okay. And there's an incisal edge that lies just labial to the long axis of this root. So imagine that we are having this long axis. Now here if I'm seeing, so this is longitudinally, but when I see like in this view, then it will be a point like this, okay, it will be going inside like that, the long axis of the root. So here this long axis, okay, this is the long axis, and the incisal edge, this is the incisal edge or the ridge, it lies labial to this long axis. So that means it lies more labial or forward, okay, over here, more front. So it is here more labial to the long axis. And mesiolabial and distolabial line angles are present and prominent from the incisal aspect. These line angles are prominent, okay. So this was something about the maxillary, that is permanent maxillary central incisor. We will be covering the lateral also in the next video. So yes, thank you.